Hello everyone, Shante Getz from Functionize Integrative Therapeutics. Today we are welcomed with Jim Getz. He is our Chief of Human Performance here at Functionize. Jim is an amazing guy with so much knowledge and experience behind him in the field of strength and conditioning, working with collegiate to professional athletes, as well as being board certified in chiropractic and physiotherapies. If anyone knows the human body inside and out, it is Jim. So we're excited to bring you his knowledge, expertise, professionalism on the topic of functional neurology and rehabilitation. This is a continued series on our concussion management program here at Functionize. So without further ado, here's Jim.
Thank you, Shante. I certainly appreciate your very kind words. So today we're going to talk about functional rehabilitation in neurology. When the brain doesn't work, things like words don't work, eyes don't work, hearing doesn't work. There is a difference between regular chiropractic and functional chiropractic, functional neurology. A doctor of chiropractic is a primary care physician who is trained typically in sport and spine injuries, where the functional neurologist is a specialist, somebody who takes their knowledge above and beyond to those next levels. The chiropractor is known for effective techniques in joint manipulation, where a functional neurologist takes an additional 3 to 4 years of didactic training. The regular chiropractor employs natural and conservative methods of care, while a functional neurologist is trained in the diagnosis and management of a myriad of neurological disorders. But what is the difference between a medical neurologist and a functional neurologist? I'm glad you asked. A functional neurologist is trained to diagnose and manage neurological disorders. The method of treatment is the differentiation. A functional neurologist offers non-surgical and drug-free methods of care. They refer and co-manage with medical counterparts. It's all about a team, and it's not one individual is better than the other. A medical doctor is not better than a chiropractor, is not better than a physical therapist, who's not better than a DO, a psychologist versus a psychiatrist. If everybody can manage patient care together as a cohesive unit, only the patient is the one who gets better. And it's all about patient-centered care. It's all about the patient. So you, as a patient, if you don't feel that your physician is putting you forth and making you the focus of care, then it's time to find a new physician. Somebody who's going to work with that team to make you better and get you to that next level and to improve upon your health. Let's get to traumatic brain injuries here. So a traumatic brain injury, to which I have unfortunately seen all too many. Quarterbacks getting hit in the head, kids falling off of a park bench, car accidents. It happens, and it's unfortunate, but it does happen. There are 1.1 million occurrences each year in the emergency room of a traumatic brain injury, which brings about 80,000 disabilities. From that, 70 to 80% are mild traumatic brain injuries. You ever see the movie Concussion? That is a mild traumatic brain injury that occurs in individuals, and the movie is a very clear dictation of what actually can occur down the road if not properly treated and handled. The top causes of MTBI, mild traumatic brain injury, there's 35%, which are slip and fall injuries. Slip on some ice, slip on a banana peel, just slip and fall. 17% is an auto accident. It can be your head hitting the dashboard, glass from the door, or it can be called coup counter coup, where your head goes forward and then backwards and your brain doesn't stop and hits your skull. 16.5 is an object striking the head, whether it be a fist, whether it be a soccer ball, a baseball, any type of object hitting your head. Traumatic brain injuries are either severe, moderate, or mild. Do not take the word mild lightly. No traumatic brain injury is mild. They all have effects. In traumatic brain injuries, there's only 1 to 20% that actually have persistent symptoms. Just because you don't have a persistent symptom doesn't mean something's not wrong. These post-concussive symptoms can be either physical, emotional behavior, or cognitive. Let me break that down a little bit. So in the physical symptoms, you can experience headaches, dizziness, visual problems, problems in balance and coordination, and even movement disorders. Emotional behavioral, you may experience increased anxiety. You may not even know where it came from. Depression, you could become irritable, not just angry irritable, but actually irritable from your brain injury. Being highly impulsive. Some individuals may start to act out. They may start to drink more. They may start to find a mate more often than not, in which they normally would not have, and I'm really cleaning it up. They may have impulses to steal. These are some negative things that may occur. They could overwork. All these things that are impulsive start to occur, which was not part of the individual's personality before. Nobody can figure out what happened. They often don't know what actually happened because they're living that and experiencing it every day, and it has negative effects. They also have apathy, constant apathy. Cognitive difficulties could be attention. All of a sudden you're not able to focus and concentrate on things like you once did before. Difficulty concentrating and focusing. Memory loss. Where did I put my keys? Happens to us a lot. It could happen even more. Where did I put my glasses? Little things like that. Also, I studied for hours and now I'm not retaining it. Language and speech difficulties, and even reading and writing difficulties. Now, these are all things that can be discovered and improved upon, but you gotta have the proper testing immediately to understand that. In managing persistent symptoms, we want to manage both pre and post health status. We want to manage your neurological impairments, your psychological impairments, physical injuries, any substance abuse that may have started to occur, and we can even co-manage, if you would, medications that you may be on, and hopefully not abusing, because after MTBI, the traits that start to ensue could start to lead down to substance abuse. So how do we actually test the function of the brain to determine what's wrong? Now, there's structure versus function, and one plays into the other. So common tests we use to measure function are functional MRI and spectroscopy. Say that 10 times fast. You got PET scans, electroencephalograms, and neurophysiological testing. All of these are employed to test and figure out where we need to go with your treatment. Now, what tests are missing? Now, functional MRIs, PET scans, cognitive testing, they fail to test how the brain responds to environmental stimuli. We can figure out and determine what's happening in a lab setting, but your brain and a lab are two totally different things. That's why so many nutritional supplements, at times, you'll notice they've got these grandiose claims that are on them. They fail to mention that the lab tests that were done are on mice, not humans. So they don't work on humans. Same thing with a lot of tests that are done. They work great in a lab, but put them out in the real world, and that's a whole new ballgame. What cannot restore function is medication. Oftentimes, a physician may put you on a medication. That may mask some symptoms. That may make you feel different. Most likely will make you feel different. But does it actually restore function? No, it doesn't. It's not changing the physiology of the brain. It's not changing the structure of the brain to which needs to be accomplished in order to restore the actual function. We need better solutions, and we need proper therapies that will target specific regions of your brain. Some therapies that must use nature's design. So we can use biomimicry, which is a sustainable innovation that is actually inspired by nature. Animals often mimic what they see, and it becomes part of them and what they do. Same thing with humans. As a little kid, if you saw somebody do something over and over and over and you thought it was cool, say a walk. If you wanted to walk with a strut, you're big and tough, and so you start walking with a strut. Tell you what, in a few weeks, a month, you're starting to walk with that strut. You're also going to start developing hip problems, back problems, maybe shoulder problems, get little headaches, but you mimicked what was going on, and that became a part of what you did. Now we need to retrain that, pull that back in order to correct everything and get you back to proper functioning. So let's talk a little bit about functional neurology and rehabilitation. So you want to objectively, we want to quantify measuring of your neurological function. You're going to identify those deficits, understand the relationships between your neurological symptoms, and then we're going to apply therapeutic strategies to target and restore that normal function. And this is what we call an evidence-based approach. This is something and a strategy that's been proven time and time again, and that we are going to utilize in order to achieve function, make you live functionized. That's the goal. So the goals, other than being functionized, of the examination, we're going to identify orthopedic, musculoskeletal, and peripheral nerve injuries. We're going to test neurological symptoms as a whole, and we're going to objectively measure these functions. In the examination, you can expect a very comprehensive medical history. You're going to expect a physical and neurological examination, and then special tests as needed. These special tests could be a computerized posturography, video nystagmography, and a saccadimetry. These are all very highly specific specialized tests in order to identify deficiencies. Now, what good are the tests unless we can actually build upon them and rehabilitate? So some of the goals that we utilize is going to be to strengthen and restore function to the symptoms that you're experiencing. Let's get rid of those symptoms and correct it from the source. We're going to teach adaptive strategies for the systems that we cannot repair, and we're going to utilize diet and nutritional strategies to support cell metabolism and minimize that risk of dementia. And when I say diet, I do mean lifestyle. In order to understand and some of these regions of your brain, we're going to have to target them specifically from the outside in. We're going to retrain your cortex from the top to the bottom, bottom to the top, to the front to the back. We are going to truly get to the understanding of the purpose of your nervous system, which is the perceptual orientation of oneself and your entire environment. We want to improve upon your sensory systems, your vision, your hearing, your taste, your smell, equilibrium, and your somatic senses. We want to restore balance and posture. We're going to work with your eyes, your ears, from the vestibular system, your centers of equilibrium, and your muscles and joints. We need to restore proper proprioception. We're going to restore the somatic sensory system. And we're going to improve upon the entire motor pathway in your brain, from your brain to the periphery and back, making sure that you work in the proper function. We're going to make sure the visual system, as I said, is going to be honed in and working properly. So everything that you take in will reach the brain properly, and then the rest of your body can react in the proper manner. There's a study in the Journal of Neurology that says impaired eye movements in post-concussion syndrome indicate suboptimal brain function beyond the influence of depression, malingering, or intellectual ability. The eyes are so important. It's also understood that vestibular and stabilometric findings in whiplash injury and minor head trauma, we need to understand the entire vestibular system, the eyes and the ears. So often are these areas neglected and just focused on the little bruise on the brain. The eyes and ears, the entire vestibular system, are what our brain takes in. So if there is something within the brain that's not functioning properly, the eyes are not functioning properly either. There is something to be said about anomalous head postures in strabismus and nystagmus. How your head is oriented compared to how your eyes are functioning. It's been determined that an abnormal head position is adopted in order to improve visual acuity. Meaning if something's wrong with your eyes, you may start cocking your head in a certain manner. It's not necessarily as big as I'm showing you right now. It could just be a little bit. little bit to the side. And your body does this to avoid diplopia or obtain a more comfortable biocular pattern for your vision. Your head can be turned, tilted, it's going to be left to the right, up, down, whichever position that you're going to be able to see better. So your brain understands better. So the rest of your body can function better. The ophthalmologic examination includes the assessment of versions lead to a proper diagnosis. When the different versions are free, the versions of your head are free here. You can have congenital nystagmus, and we can start to understand a paralytic restrictive strabismus that occurs. Pretty much what it comes down to is head position means a lot. And your body is going to constantly adapt. It's going to adapt in every sense in order to keep your head oriented so your eyes see the entire horizon level. Your brain is able to receive everything through that, as a result, more normal, and your body will function more normal as the result. So any abnormalities that go along with this, we need to identify and correct along the way in order for you to have a normal life, if you would. Let me tell you a little bit about some of the special tests like video nystagmometry. It's the gold standard for evaluation or dizziness of a balance disorder. It actually objectively measures the reflexogenetic and volitional visual systems controlling the eyes. It's really cool stuff. I like equipment, so when I say it's really cool stuff, I just ask you to bear with me because it's fascinating how it works and how the body perceives it. So with video nystagmography, it differentiates peripheral versus the central part of the nervous system. Traditional use has greatly been undervalued. It's not used much. And it provides us with great detail of sensory, motor, and cognitive domains which contribute eye movement and their related executive functioning. Saccadimetry is another very cool, if you would, piece of technology and equipment. It is the possible application of latency distribution measurement for monitoring a concussion. After a concussion, premature to play of your sport or playing the sport of life, if you would, has debilitating or even fatal consequences. So utilizing computerized neurophysiological test batteries widely are used to monitor recovery and help the individual return to play. Revamping visual stability. Visual perception is often based on both incoming sensory signals and information about ongoing actions. So recordings from a single neuron have shown the corollary discharge that signals can influence visual representations in a parietal, frontal, and exstriate visual cortex, as well as the superior colliculi in your brain. In each of these areas, we remap the representations of your brain sees the entire world. And based upon that, you're going to be able to live a far more effective life. When we talk about saccades, rapid eye movements here, they shape the same pathways for physical movement. It all originates from the basal ganglia, and some of the learned movements is when you go through the thalamus and the cortex, you get learned finger movements. When you go from the basal ganglia to the brain stem and the other motor centers, you're going to initiate head and eye movement. You're going to initiate locomotion, mastication, always good to eat, and vocalization like you're listening to me right now. Some therapeutic strategies with functional neurology and rehabilitation. We like to utilize balance training. We have a phenomenal piece of equipment here. It's called the Balance Tracks. It's the gold standard of balance training. We utilize biofeedback to not only test to see where you're at, but to work with you daily and improve proprioception, and we can actually see the improvements, how it works throughout your entire session on there, and it does not take very long. And it's almost like a little video game, I gotta tell you. It's actually a lot of fun. We do peripheral nerve stimulation and visual feedback. All these are strategies used to rehabilitate the entire neurologic system. We're going to remap your visual stability, balance training, peripheral stimulation. They work. We can also do some gait training and hemifield visual stimulation. We were talking about how your head moves in different directions to keep your eyes at the horizon. Well, when you're walking, the same thing happens. Your body has to be retrained in the way that you walk in order to keep your eyes at that horizon, and that's something that we definitely can work with you on here. Some other strategies we work and implement is spinal force. We correct and work on your frontal lobe and your cerebellum. Different tools that can be used is an isokinetic ergonometer, and with the gait training, there's a myriad of different tools that we can utilize for that, including but not limited to one of our favorite things to use is biofeedback. We can use mirror imaging. We can mirror image how neurons are firing in order to create better output, and this is often used in rehabilitation of stroke and minor traumatic brain injury. We can work on vestibular rehabilitation. We can also work on velocity storage. Again, very, very important things to work on in order to recover from any type of trauma, especially head trauma here. I will not drain you of all your time. I know your time is important. And I want to thank you for joining us here on part 2 of our series on concussions and rehabilitation after concussion. We keep bringing this to you because we know that this is a often, I don't want to say misunderstood, but it is almost misunderstood, because if it was properly understood, it would be taken more seriously. We're very passionate here at Functionized about individuals that suffer from concussions, because it happens all too often, and it's happened to us on many occasions too. How many baseballs have drilled me in the side of the head? I have lost count. But I'm in the right place here, and you will be in the right place here as well to restore function, get rid of those headaches, get your memory back, get rid of those bad habits, rewatch this again and again and again, and truly understand rehabilitation from concussion. Thank you so much for your time and being with us. Check us out next Monday, same Functionized time, same Functionized channel, and I'll catch you there.